Hi, everyone. For those of you who don't know me, my name is Cindy Peteshin. I am the psychologist for the cardiac program at the Richardson Hospital. Today, we're going to be talking a little bit about sleep because often the clients who come here have difficulty with sleep. We'll talk a little bit about why it's important to sleep well, what you can do to help you sleep, and what you may be doing that does not help you sleep. So let's go. Now, sleeping, is it necessary or is it really a waste of time? So I have heard of people that can sleep 3-4 hours a night and they get along just fine. However, those people, there are very few of those people. So for most of us, we need to get good sleep. Otherwise, we're going to have some of the problems that you can see here. So for example, you might have a reduced memory capacity, so you'll have trouble with your short and long-term memory. You might have trouble with attention. You have a higher risk of falls. We're not as balanced. And you might have a little change in your strength. Now, the other item here is an increased risk of driving accidents, which may not be readily apparent to you, but it turns out that if you don't get good sleep, especially chronic not good sleep, it's kind of like driving when you're drunk. You get a very similar risk. So as you can see, there are some good reasons to get good sleep. But why are we concerned with sleep in the cardiac program? That's because reduced sleep time can lead to things like high blood pressure and an increased risk of heart disease. Okay, it's not only your heart that may be affected, sleep can also affect your blood sugar level and whether you might be at risk for getting diabetes. So reduced sleep can lead to increased blood sugar levels, and that even after one night, you can see a change. But it's not only the sugar level itself. If you have even partial sleep deprivation during 1 week's time, this can increase insulin resistance. So what does that mean? That means that you're going to have a higher level of sugar circulating in your blood. So, like I said before, reduce sleep. And here we say it's about 7 hours per night. That's on average. That's a risk factor for developing type 2 diabetes. On the other hand, sleeping too much is also a risk for developing type 2 diabetes. It says 8 hours here, but we're not thinking 8 hours and 5 minutes. It's more like 9 hours and above. So if you find that you're sleeping more than you should, it's time to check it out with your doctor. So a lot of us are concerned with weight gain. Okay, we want to retain that lovely physique we had when we were 20. And so you should know that short nights of sleep, and like I said, on average, approximately 6 hours or less, that can increase the risk of obesity. Again, like with diabetes, if you sleep too long, that's also a risk. But if you're going to err one way or the other, the risk is smaller if you sleep less than if you sleep more. And that should make sense because more time in bed means less exercise. So I don't know if that's the reason, but you can think of it that way. The other thing is that when we don't get enough sleep, we tend to seek out the comfort foods. So those are foods with high fat, high sugar, high salt. One of the hypotheses that has been used to explain why sleep has an impact on weight gain is the idea that sleep may influence the hormones related to eating behavior. So they're called ghrelin and leptin. And so this can lead to disordered food intake. So leptin is the hormone that says to your body, I'm full, I should stop eating. And ghrelin says, I'm hungry, I should keep eating. And if you have an imbalance of these, for example, if you have more ghrelin circulating in your blood, it's going to say, keep eating, even though you're not hungry. Unfortunately, as we get older, our sleep tends to change. So around 50 years old, it's possible your sleep could get more fragmented and you could wake up more often in the middle of the night. So sleep itself often gets shorter, and that has an effect on the stages of sleep that we go through during the night. So the longer you sleep, the more likely that you will have more REM sleep, dreaming sleep. For women, menopause may result in sleep difficulties. And here's an example that is easy to understand. If you're having hot flashes, that may make it difficult for you to sleep, but it also may wake you up. So what can we do? Because we do want to get good sleep. So when we reach a certain age, we might have to retrain ourselves, retrain our body to sleep well by maintaining good sleep hygiene. Now, you know what hygiene is in general. Hygiene is a set of practices to help us remain healthy. So what we would do for what we normally call hygiene is we would take showers, we brush our teeth and wash our clothes and things like that. Well, there are a group of behaviors related to sleep that promote good sleep, and that's called sleep hygiene. But before I talk about the things to do, I thought it might be good to talk about the things not to do. So these are examples of behaviors that may make it harder for you to sleep. So we'll go through them slowly. If you have questions at the end, not a problem. So, and they're not in any particular order. The first one I'm going to talk about is solving your problems in bed. Now, this is if you sleep alone, if you sleep with a partner, this is not the time to rehash the things that you're finding difficult and try to find a solution for them. You don't want to do that when you're tired. So you can mark them down and take a note of them and think to yourself, you know what, I'm going to tackle them tomorrow. There are a bunch of, I'll say, things related to food that can make it more difficult to sleep. So what are they? You don't want any stimulants before you go to bed. What are stimulants? What are things that wake your body up? Coffee, nicotine, energy drinks, and alcohol. Now, alcohol is a little bit different than the other stimulants in that initially it can make you more drowsy, so you will fall asleep, but your sleep will be lighter and it won't be great sleep. And most likely you're going to wake up in the middle of the night, and it could cause you to have to go to the bathroom more often. The other three stimulants, even when you take them in the morning, coffee, nicotine, energy drinks, they sometimes have a delayed reaction. So you want to take them as early in the day as possible. The other thing related to food, or whatever you intake into your mouth, are big meals. So you don't want to have a big meal late at night. A light snack is okay, but if your stomach is processing all this food, it's harder to get to sleep. Taking a nap. So sometimes we don't get good sleep, and the day after we'll be really tired and we'll take a nap. If you do it every day, it can make it harder to fall asleep at night because your body is not tired. So if you really need a nap, if you're not physically disabled, if you just have a regular amount of energy and you want to take a nap because you're tired midday, take a nap 10 to 15 minutes and try to do it earlier in the day. So here it says before 3, but before 3, before 4, you don't want to be taking a nap every day to try and help you with your sleep deprivation, because the quality of the sleep that you're going to get when you take a nap is different than the sleep you would get by sleeping overnight. You don't want to be spending time awake in bed. What does that mean? You don't want to be reading in bed, eating in bed, talking on the phone in bed, watching television in bed. You just want to reserve your bed for sleeping and for sex. If you do other activities in your bed, then you make the association that your bed is not a place to sleep. That's the opposite of what you would like to do when you see your bed, when you're sitting on your bed, lying on your bed. You want to be saying, I'm really tired, time to sleep. Exposure to light is going to wake up your body. And so there's different types of light in your room. If you have overhead lighting and it's really bright, that's not the light you want to use at night. You may want to use a small side lamp. But besides that regular type of light, you don't want to be in bed looking at the light emitted by electronic devices. That's your television, your cell phone, a computer, a laptop, a tablet. Some people have books that they read in electronic format. You don't want to be looking at those things right before going to bed, because blue light suppresses the production of melatonin. Melatonin is the substance in your body that helps regulate your biological clock. And so by turning this light on, you're saying it's not time to go to bed. You also don't want to stay in bed early in the morning. Like I just mentioned, your biological clock is going to help you fall asleep, stay asleep, and wake up at the right time. But if you stay in bed when you're awake in the morning, it's going to delay your biological clock. And so it's possible it could disrupt your sleep the following night. So these were just a few examples of things that you should not be doing. And now let's look at what you should be doing to help you get better sleep. So we're going to start with clearing your mind. You can take a few minutes before going to bed to prepare for the upcoming day. Now, how do people do that? Sometimes they put out their clothes, they mark things down that they don't want to forget. They may make a schedule for the next day. And don't worry if you don't do it exactly the way that you think you should. Okay, you forget something, don't worry. Put a pad and a pencil next to your bed, write it down, and then return to your bedtime routine. Okay, so you're clearing your mind, and your bedtime routine should include activities that are going to help your body settle down. Okay, so part of this could be doing relaxation. And here are some examples. So you might like to do deep breathing, taking a bath, meditation, reading, any activity that is going to help you calm down your body and calm down your mind. So These techniques are good to help you fall asleep, but also if you wake up in the middle of the night, these techniques can help as well. The trick is you want to learn these techniques and practice them before you need them. Physical activity. So you come here to the gym to help increase your physical activity, and regular physical activity can promote good sleep. However, it depends on what time of day you're doing it. So it's great to get out during the day, be physical, but let's say after dinner is not the time to be exercising. So I've had clients come to me and say, I went to the gym after work, I got home and I just could not sleep. The earlier in the day that you do the physical activity, probably the best you're going to have it on do this physical activity on a regular basis, and it's not going to interfere with your sleep. The reason why intense physical activity affects your sleep is it increases your body temperature and it ramps up all your body processes. And so that makes it hard to sleep right after that. When should you go to bed? Okay, so some people think you go to bed 11 o'clock, you wake up 7 o'clock, I get 8 hours, that's wonderful and fantastic. However, if you go to bed and you're not tired, you're just going to lie there. It's not as if you try harder, you stay in bed and you're lying there and you can't sleep. If you try harder, you're not going to sleep any better if you're not tired. So you should go to bed when you're tired. If you're not sure when that is, there are some body signals that you can look at that will help you determine, am I tired? Is it time to go to bed? So as we get more tired, our body temperature goes down. Some people may notice that they start shivering. Your concentration is a little worse before you go to bed or when you're tired. So for example, if you're reading, you may have to read the same line of text a number of times before you get it. Some people's vision goes a little blurry. Frequent yawning can be a sign that you're tired. And in general, I think you would feel the need to lie down. So you think you're tired, you go to bed. What do you do if after 15 minutes you're not asleep? Because remember, you don't want to be lying in bed if you're awake. Okay, so if you haven't fallen asleep and you still feel awake after 15 minutes, most likely you're not going to sleep. So get out of bed and do a calm activity. You don't want to be moving your body. You don't want to be doing something stressful. And you don't want to be doing something in conditions of lighting that are very bright. So here are some examples. Some people do crosswords, Sudoku. Some people do reading, knitting. Some people actually do activities in the dark. There is no one magic recipe for everyone. The idea is get out of bed, even if you're sitting on the floor next to your bed, and as soon as you feel sleepy, go back to bed and try and sleep again. When should you get up? So if you have trouble sleeping, it's good for you to get up at the same time each day, even on weekends. Okay, that's going to help you with your biological clock. It'll tell you this is my routine and I'm going to get up the same time every day. If I don't have the alarm clock, my body's going to wake me up. So you want to get into this right rhythm, and hopefully you're going to have light when you get up. If you have a normal schedule, you will, and light exposure will help wake you up. Now, in terms of your regular routine of going to bed, at a certain time and getting up at a certain time. If you have to make an adjustment, it's better for you if you change your sleep time rather than changing your wake time. So for example, if you went to a wedding and you stayed up really late, get up the same time that you normally would the next morning. So those were tips of what you can do. Here are some other general tips that may help you sleep. So if you have trouble sleeping because the thoughts are rolling around in your head, you might want to learn how to manage your stress better. Some people can do that by themselves. Some people need a little help. If you find that you're anxious when you go to bed, it's probably a good idea to look into a technique that will help you deal with the stress during the day. Some people have sleep apnea, and they may not exactly know that they have sleep apnea if they sleep alone. They may just know that when they get up, they're really tired. Sleep apnea causes periods of wakefulness, and you may wake up thinking you have to catch your breath. Okay, if you think that that may apply to you, then check it out with your doctor. If you're a man, you may have prostate issues. And so you may find yourself going to the bathroom frequently during the night to urinate. Again, you can check with your doctor. There may be something that you can do about that. Some people will take supplements or tisanes, let's say, to help them get drowsy. So for example, if you're thinking of taking melatonin or valerian, these things can interfere with your regular medications. I'm not saying don't take them. I'm saying if you would like to take them, ask your doctor or ask your pharmacist whether this would be a good choice for you, given the medications that you are taking. So, in conclusion, we went over a few behaviors related to sleep. We talked about what is good to do, what's maybe not good to do, because you want to optimally try to get in between 7 and 8 hours on average of sleep every night so that you feel rested when you get up. Engaging in good sleep hygiene promotes better sleep, better energy, and better health. So why shouldn't you try to get the best sleep that you can? It's really important that your bed is a sanctuary for sleeping. You want to associate sleep and your bed. Lastly, I just want to say thank you for attending this capsules. If you have any questions, feel free to call us or email us, and we will get the answer to you. So I wish everyone good sleep. Bye.